more effectively to get better results for people. We spend a higher percentage of our GDP than most European countries. We're not getting the results that we should, so we've got to innovate. The one thing that I've seen is that we have a lot of costs that are driven by healthcare issues that are driven by personal choice. Choices that people make in their lifestyle that can have a positive impact if we can change that. If we can become more active, we can reduce a lot of the costs around heart disease and diabetes. So there may be ways that we can drive down some of those costs that are impacted by the lifestyle choices we all make and get better outcomes and save money at the same time. So I think that a lot of the reform around healthcare could be accomplished without taking away all of what I think will happen under PPAC. I mean, maybe we could talk about that, but I think it's going to take away a lot of choice that we have as far as our individual insurance, how we handle that. A lot of smaller companies are going to choose not to offer health insurance. What they'll do is they'll pay the tax that's included as a part of PPACA, and most people who now maybe have access to health insurance through their employer will be forced then to go through an exchange. So there'll be a lot of changes in the way that people obtain their health care. And I don't think, particularly in Wisconsin, that was necessary. We had recently, maybe it's dropped a little bit since the recession, but we had 93% of the people covered with access to health care and with coverage within the last few years. And even with PPACA in place, we're still going to have about 3 or 4% of people who don't have coverage or access under this plan, even with all the changes that it's going to impact in our state.
So we're still summarizing?
Yeah.
Okay.
I'll try to do that.
No, I actually want you to pair it word for word. What are the highlights?
So I think, well, Representative Stone was saying that as far as what we should talk about, as far as reform outside of the Affordable Care Act, is Wisconsin is a reformer already. We have companies that are reforming, such as Quad Graphics, for example. And so there is innovation out there, reform already going on in Wisconsin. Your concern is that under the Affordable Care Act, it'll go in the wrong direction to some degree because a lot of companies will have to go to the exchanges. And therefore there'll be less choice than the reforms we're seeing now from people like Quad Graphics. And we already have a system where we have a relatively low level of uninsured compared to the rest of the country, not the rest of the world, with it was 93% covered until recently before the Great Recession. So that's fair. So I think what's interesting if you think about this, right? Healthcare reform for years, people have tried to figure out a way how to break off little pieces of it and how to do incremental things that don't deal with the whole system. But it's sort of a systemic problem, and in fact it helps drive home the problem that we're all in it together. Unless we solve it for all of us, there are going to be people who are left out and fall between the cracks. So I agree that there are companies that have tried to save a lot of money. I've met with the people at Safeway in California who actually support the Affordable Care Act. They've saved 40% on their health insurance costs by doing reforms like Quad Graphics. In fact, there's a new study that shows that 1/3 of medical spending in the United States is not value added, it's waste, because we have a system that overemphasizes specialty care. And there's a huge amount of excess cost in the system that we could deal with. But the best way to deal with that is to deal with the system comprehensively. As long as we leave a lot of people out, it's now 10% uninsured in Wisconsin, and that's not all the people at risk. Everyone who has a pre-existing condition, over 1/4 of the population, is at risk of discrimination if they ever leave their current job, and which will probably happen in their lives, or if they work for a small business. There are people all over the state and country who don't start small businesses, don't do other things in life because they hold on to that one good job that provides health insurance. So it really breaks down entrepreneurialism. And what the Affordable Care Act does comprehensively is it leaves the current system in place where it works, but it creates a backup system for everyone else. An expansion of Badger Care and then this competitive health marketplace. And the one system, I know Representative Stone is concerned about companies paying the fee and going into the exchange. Well, on the exchange, employees will have much more choice than they have today. They'll be choosing from 5 or 6, 7 different competing companies. But in addition, in Massachusetts, we have a working model of this, In Massachusetts, most companies have provided coverage and most people have taken it. They have 98% people insured. And so a lot of the fears about companies paying the fee haven't been true. And if you're a small business, 32% and falling in Wisconsin provide coverage anyway. And the exchange starts with small business. It's up to the legislature, Jeff Stone, excuse me, former legislator from Eau Claire, who's running again, I think. But anyway, Jeff Stone will have the opportunity to decide year by year after 2017 whether to expand it to larger businesses. Small businesses are already not served by the current system and need this system desperately. So.
You want to address that?
Sure, yeah,
here,
sure. Okay, a few of the things that you touched on were the idea that Safeway, and I'm not sure, is that the grocery store company? They've saved 40% through some of those health and wellness initiatives that I have pointed out as an option. You bring up the fact that it's been estimated up to a third of healthcare is lost to waste in the system. 10% of our folks now are without healthcare coverage, so we have a growing population that aren't met. And one of the points that you make that I find very interesting is the idea that, you know, we have people that are really captive to having health insurance because of the issues with pre-existing conditions, and so they're very concerned about leaving employment, losing that insurance coverage. So, you know, I think those are all elements that I think, you know, we kind of agree on in many ways. The question is, how do you solve that problem? You know, we've seen some of the elements of the Affordable Care Act have already been implemented. Now you have coverage for dependent or young children up to 26 years of age. That's been implemented. I think, and I'm not positive about the pre-existing conditions, but I think that that's coming into place.
Children was eliminated.
Yeah, so we've eliminated that in some areas. So some of these reforms are coming into place, and you know, I guess I would say we're dealing with those changes within the marketplace. But I don't know that they come without a cost or a price. I think that what I get concerned about is the idea that, you know, I would agree that there's waste, but I think some of that waste is driven because we need people, each one of us has to have some level of contribution and responsibility in maintaining our health and wellness. And when I talk about those programs like Quad, for example, I use them because they're a great example and a national leader. One of the things that they do is they focus on saying, how can we have positive rewards for people making those good choices? When I've surveyed even healthcare providers in our community about what kind of wellness incentives do you offer, up until recently, a lot of them would say, well, you know, if you do all the right things according to, or you do a risk assessment and you follow through on the recommendations, you might get $40 at the end of the year. And I always say, boy, when I'm going to the Brewers game and reaching for my second brat, I'm not really thinking about a check for $40 I'm going to get 9 months from now. And so we need to have incentives that are substantial, that help people to take those positive steps. The Quad Graphics plan, for example, each person that's covered under their program can get a check of up to $700 at the end of the year if they've done a wellness, if they followed through on their wellness program and done a health risk assessment to say this is where my issues are. And I think that's the kind of thing that we really need to be much more focused on, is saying how do we get each individual person more engaged in maintaining their health and wellness. I don't want to say, you know, everybody, you know, people can get sick, you can have injuries or illness, and it's not any fault of your own. But we also need everyone to be engaged as much as they can in helping to contribute to maintaining health and wellness, because that's where a lot of that waste is. We're treating things that are happening because of the choices that we all make collectively and individually.
Well, so Representative Stone, in response to Robert's points, that all of these changes that